Okay, good morning or good evening, depending on the time you're watching this video. In this video, I will go through a reading exercise based especially on a clinical case. So this is very important for physicians or medical doctors for expanding your vocabulary, okay? So the clinical case is based on post-menopausal bleeding. Let me first read the history. A 58-year-old woman reports postmenopausal bleeding for 6 months. Initially, she did not pay much attention to it, but she has had several episodes and it now occurs most days. It is generally light, but for a few days recently, it was almost like a period. There is no associated pain. The woman is never married or been sexually active. She has no previous gynecological history and has never had a smear test. She was diagnosed with type 2 diabetes 4 years ago, for which she takes oral hypoglycemics. However, she is not very compliant with diet modification and her blood glucose is not well controlled such that starting insulin is being considered. Examination. The woman is obese with a body mass index of 32 kg per square meter. Her blood pressure is 150 out of 80 millimeter of mercury. The abdomen is non-tender, but due to the adiposity, it is not possible to feel abdomen masses. External genital examination is unremarkable. Speculum and bimanual examination are not performed as she has never been sexually active. Transvaginal ultrasound was not possible, and a trans-abdominal ultrasound examination was therefore performed with a full bladder. Investigations. Trans-abdominal ultrasound reports the uterus is normal size and inverted. The endometrium could not be clearly visualized. Both ovaries appear normal. Ultrasound view was restricted by patient adiposity. Examination under anesthetic and hysteroscopy. The vagina and cervix appear normal. Hysteroscopy showed an irregular vascular mass arising from the uterine wall with contact bleeding. Curettage was performed and product sent for histological examination. The findings at hysteroscopy are shown in figure 22.1. Yeah, I think this is the first part of my reading. You can see the figure as information. Figure 21 plus 22 plus 1 is stereoscopy findings. See plate 4 for color image. Questions. What is the likely diagnosis? If this is confirmed, how will you manage these patients? Thank you for watching this clinical case, and now I will go through different vocabularies and grammar patterns that we can keep in order to improve our capacity of speaking English, and giving some advice for improving reading capacities.
Expand your vocabulary. Bladder, a part inside your body that is like a bag where urine collects before being passed from the body. Curettage, a surgical scraping or cleaning by means of a curette. Diabetes, a serious medical condition in which your body does not produce enough insulin to reduce the amount of sugar in the blood. Menopause, the time in a woman's life when her periods stop and she is no longer capable of getting pregnant. Speculum, an instrument inserted into a body passage especially to facilitate visual inspection or medication. Quick grammar lesson. Learn from this sentence. Initially she did not pay much attention to it, but she has had several episodes and it now occurs most days. Thanks for watching this video. This is English with Bro Damien. Like and share, leave a comment, and subscribe to my channel not to miss the next video.